Hi, so welcome back. Today I'm going to be talking about obsessive compulsive disorder and the psychopharmacology we use when medications are indicated to treat OCD. Now, obsessive compulsive disorder is very interesting to me because I personally suffer from obsessive compulsive disorder, and a lot of people feel obsessive compulsive disorder. They make a joke like, oh, this is my OCD because something isn't perfect or in line, like a tile in a bathroom wall doesn't line up, or a tile on the floor doesn't line up with the other tiles. They say it triggers their OCD. And in some cases, it can be severe like that, but usually that's not what OCD is. OCD is when someone feels compelled to do something. It could be compelled to say something or compelled to wash their hands repeatedly because they feel if they don't, something bad is going to happen to them. Sometimes people pray. It could be up to hundreds of times a day because they feel if they don't, something bad would happen. But also, OCD, it can be characterized by intrusive thoughts and unwanted thoughts and obsessing over the thoughts and being afraid that if somebody's having harmful thoughts of hurting someone, they're actually going to hurt someone. And these thoughts can be overwhelming and can cause disability in someone's life. So, let's look at the pharmacology and what kind of medications are used to help treat OCD along with counseling. Alright, so when somebody started or being considered for obsessive compulsive disorder treatment and being considered for drug therapy, the first go-to option is antidepressants, specifically selective serotonin reuptake inhibitors. This includes your sertraline or Zoloft, Lexapro, Celexa, Prozac, Paxil, and the guidelines recommend SSRIs first line, and they don't recommend the regular dose for depression as depression, but they recommend usually up to double the dose for the SSRIs over the dose for depression. So a lot higher doses of these SSRIs are needed to treat OCD. Clomipramine is a tricyclic antidepressant, so it's not SSRI. It's more like a serotonin norepinephrine reuptake inhibitor, but it's in the class of tricyclic antidepressants, and it's a little bit of a dirtier molecule than SSRIs, meaning it hits a lot of receptors, so it may be good for treatment-resistant obsessive compulsive disorder or to be used in combination with the SSRI, which they have used in some studies. Fluvoxamine is another antidepressant, but is only FDA approved for OCD. The thing about fluvoxamine or Luvox is that it has a number of drug-drug interactions, and it can interact with quite a bit of drugs, increasing the risk of adverse drug reactions. So it's generally avoided because it can interact with someone's other medications. Mirtazapine is another antidepressant that works differently than the SSRIs. Mirtazapine works on the alpha-2 receptors, and it increases the monoamines that way. Mirtazapine was shown to accelerate the response of Celexa to 4 weeks from 8 weeks. Another study, a small-scale study of 30 subjects, showed improvement in the Yale-Brown Obsessive-Compulsive scale over the course of 12 weeks at 60 milligrams a day of mirtazapine. Venlafaxine, which is a serotonin norepinephrine reuptake inhibitor, or SNRI, was shown to be as effective as paroxetine, but it may be less tolerated than SSRIs. So, if antidepressants are not effective enough for treating obsessive compulsive disorder symptoms, they may add on adjunct antipsychotics. And adding on an antipsychotic can augment the antidepressants. Obsessive compulsive disorder is considered to occur due to too much dopamine in the frontal lobe causing the obsessive compulsive disorder symptoms. That's just one theory behind it. So, if you add a dopamine blocker, which many of the antipsychotics are, all of them are, then that could potentially alleviate obsessive compulsive disorder symptoms. And actually, haloperidol has an indication from the FDA for treating OCD. The antipsychotics with the greatest strength of evidence are risperidone and Abilify. So, Abilify is kind of surprising to me because it's not a full dopamine blocker. It's a partial dopamine agonist. So that makes me think that maybe the OCD symptoms aren't all due to a hyperdopaminergic state. Results were inconsistent, though, for olanzapine, Seroquel, and haloperidol, although it has that FDA indication, at least in one study, but did show efficacy in at least some patients. Another alternative is adjunct lamotrigine. We see that most often used with bipolar depression, but a 16-week trial of 33 patients given 100 milligrams a day compared to placebo and adjunct lamotrigine to SSRI showed significant change in the Yale-Brown Obsessive-Compulsive scale. And 100 milligrams a day isn't that big of a dose, so I'm wondering if a higher dose could be helpful with obsessive-compulsive disorder. And then there's tramadol, which is a partial opioid agonist, which we see in pain, usually to treat pain. But tramadol also has effects on the serotonin receptors and norepinephrine receptors, so it kind of works like an antidepressant, anti-anxiety agent. And it has shown to have some efficacy in refractory OCD. And then there's adjunct celecoxib, which is another pain medication. It's an NSAID. And the idea behind using an NSAID is a lot of theories are going around about how inflammation in our body has a huge impact on our mental well-being. So if we can decrease that inflammation with, say, an NSAID like aspirin or celecoxib, then it can potentially help our mental well-being. And this study, which looked at Prozac and celecoxib, decreased the symptoms of obsessions and compulsions significantly more than fluoxetine alone. And then we already talked about the augmentation of SSRIs with clomipramine. It hasn't been extensively studied, but the addition of low-dose clomipramine to patients with no response to partial response to an SSRI may provide additional benefits. And then finally, there's adjunct topiramate, which is used for migraine prevention, and it's also used for, say, if somebody has a binge eating disorder, and sometimes it's used for a mood stabilizer as well in bipolar disorder, but it can have a lot of side effects as well. It's called Dopamax, but sometimes it's termed Dopamax. And there's been a couple studies where it's been found to help with OCD symptoms. Well, that sums up the literature review I did of psychopharmacology for obsessive compulsive disorder. These are the studies I looked at. If you want to dig into them more with your on your own time. If you have any questions for me, feel free to leave a comment and I will get back to you. Or if you want to share information, feel free to do that as well. I thank you for your time and I hope you have a nice day.